Hello friends, hope you're well. In this video, I want to talk about how to find and interview candidates for your agency. So these are home caregivers for your home care business. One of the things that is a challenge nowadays is to recruit really good caregivers. And I understand why, because a lot of these agencies or businesses, they're not paying enough. And even if they do pay enough, the work is so much that they get overwhelmed. So what tends to happen under these conditions is that the best caregivers just opt out of the industry completely. This is why you're seeing a lot of nurses, a lot of doctors quitting their job. But it does not mean there are no good people out there. There are plenty of good people. Let me tell you my strategy, and I think you guys should copy this strategy. We all have somebody in our network that is in this industry. That person in your network could be an elderly couple, a friend, family friend, somebody you worked with years ago. When it comes to recruiting, start with your network before you go to platforms like Indeed. Because when you go to platforms like Indeed, you're just gonna be losing a lot of money. I promise you that. You're just gonna be losing so much money when that perfect candidate is just one phone call away. Let me tell you what I did. I went through my contacts list on my phone, and I have so many people that are my contact. And I just remembered all the people that treated me with respect and all the good people. And I just hit them up. I just called them. I just called every single one of them. I just told them, hey, listen, I'm looking for a home health aide right now. Do you know somebody that's really good? So I just went from contact to contact to contact until I came across a really good lead through this couple that I knew. This is a married couple. So usually I like to deal with married couples because people that are married, they're very good at identifying BS, and they're very good at making sure that they filter out all the people that are potential problems around them. It's just the way I operate in my marriage, and I know a lot of people that are married operate the same way. They know how to eliminate the BS. I trusted this couple because they've been married for a long time. They've probably been married for like 30 years, and they look so happy, by the way. Like when you come across them, I'm probably gonna put a picture of them, and I won't give up the names, so I'll put a picture of them so you know. When I reached out to them, they were so excited to talk to somebody that gets what they're going through. Because people are getting shady nowadays, especially when people live alone, they're lonely, they start acting weird. So I knew these people knew somebody that's good. So I just said, listen, I only want to work with the best. Please, please. I don't want anybody that's gonna give me headaches. I don't want anybody that's gonna give me problems. Please give me a good one. And they said, okay, cool, we'll give you a lead. And then that's what they did. So instead of me scheduling that interview over like a Zoom call, I decided to just do a simple screening call first. And then I got a good vibe. Now, by law, legally, there's certain interview questions you're not allowed to ask, and there's certain interview questions you can ask. The easiest way to figure out what kind of questions you need to be asking for your state is to go to ChatGPT. You go to ChatGPT, you enter in a prompt to create some interview questions that you can use to interview a home health aide for your state. And what ChatGPT is going to do, it's going to spit out all these questions, and you're going to edit them a little bit to fit your needs. And then you take those questions, and those are the questions you're going to be asking the candidate. So right now, as you can see, I'm outside of Starbucks, right next to Chick-fil-A as well, because I'm going to get hungry a little bit later. And the reason why I'm outside Starbucks and Chick-fil-A is because when you are looking for the best candidates, it's best that you go to them, because they're going to be in high demand. And they already know there's a lot of people that are looking to hire them. Especially if they're already employed right now, they're not about to play games. In order for them to take you seriously, you need to go out of your way, like I'm doing right now. So right now I'm going out of my way. I had to drive almost an hour to her neighborhood and interview her in a Starbucks, because I asked her, you know, if she knows a Starbucks that is close to her house. And she said, yeah, I got a Starbucks close to my crib, so let's meet over there. That's exactly what I'm doing. And I downloaded all my interview questions from ChatGPT. They're on my phone now. So I'm gonna conduct this interview for you guys so you can kind of understand how it's done. In order for you to get people that are the best, that are serious, you have to go the extra mile. Because when you go the extra mile, you're gonna get the gains that you really want. Then you're like really cooking with gas. We'll jump into the interview as soon as the candidate gets here. Hello Dee, how are you?
I'm fine, thank you.
Good. Greetings and welcome to Starbucks, where we're gonna do this interview for a caregiver position. And I just have a couple of questions I want to go through.
Sure.
For the interview process, and these are questions that are pretty much I'm allowed to ask you. There's certain questions I'm not allowed to ask you right now, okay?
Okay.
Cool. So we're going to start with the general background experience. And first question I have is, can you describe your previous caregiving experience or your current experience?
Well, I've been a caregiver for many, many years, over 16 years. I started right out of high school. I have experienced in private care, hospitals, long-term care, also rehab.
Oh wow, that's a lot. So
Yeah.
what kind of certifications are you required to have for that?
Well, HHA certification, I'm a CNA, so phlebotomist, CNA,
Good.
certified nursing assistant.
Awesome.
Yes.
Have you worked with clients with specific conditions like Alzheimer's or physical disabilities or anything like that?
I have worked with clients with Alzheimer's, dementia, fractured femur, cancer.
Wow. So out of all those categories, which category would you say was your best? Which you excelled in?
Well, I would say equally.
Yeah?
Yeah.
Come on, some had to be annoying, no?
Well, I like working with dementia patients.
Okay, good.
Yeah, because
Why?
you get a sense of satisfaction, because dementia is a really complex disease. So you learn a lot while you're working with clients with
Okay.
dementia.
So let's say in a perfect world I was to, extend an offer to you. When would you be available? What's your availability looking like right now?
As soon as possible.
Okay, good. If the money is right.
Yes.
Okay, good. I like that. Okay, perfect. And then, how do you handle emergency situations or unexpected client health issues? You mentioned dementia, right? Have there been any emergency issues there when you're dealing with those kind of patients?
Well, I have experienced, yes, emergency issues.
Okay.
It all depends on the client's care plan. Some people want you to call their family first.
Okay.
Some people want you to call the agency first.
Mm-hmm.
Some people want you to call 911 first.
What do you think?
So-
What do you think? What do you think makes sense for you? With your experience.
It depends on the emergency.
Okay, I see.
So if it's a physical emergency like a fall or, then you call 911.
But I feel like you have a lot of experience. You'll be able to make the right call of what
Yes.
makes sense, right?
Yes,
Okay.
you use your discretion.
Okay, gotcha. So when you do the care plan, can you kind of describe to me what your process is when you're coming up with a care plan? What are some of the things that you do?
Well, most clients have a care team, so you have scope on what you're able to do legally. So RN and the family would be the one doing the care plan and include you. So if the care plan says you follow the care plan, if the care plan says that she's not eating breakfast at 10 o'clock, call the son, well, that's what you do.
Gotcha. Have you ever had to create a care plan from scratch yourself?
No.
Okay. But you'll be able to
But
do
I'll
so,
be
right?
able to do that.
Okay,
Yes.
good. Because you gotta enough
Because once you get to know the patient,
yeah.
and you know, so if the patient is alert, then you ask the patient their likes and dislikes, and
Yeah.
from that you can create a care plan.
Good. Because a lot of clients that I'll be dealing with are wealthy, sensitive people. They have very weird needs. You know, very sensitive diets. They don't eat like us, right? They have very sensitive diets.
Right.
So that leads up to this question. A lot of people don't know how to cook. Are you able to cook if you're asked to?
Yes, I'm able to cook. If I'm not able to cook what they want, give me the recipe and I'll cook it. Trust me.
Wow, you can throw it down
Yeah.
like that? Wow, you're hired. Anyway. Okay, cool. There you have it. I hope you got some value from this video. If you're interested in starting your own home care agency or home care business, schedule time. I'll show you how to do it. I'll show you how to find these wealthy clients. I'll show you how to even interview, find caregivers. There are really good candidates out here. There's some really good caregivers out here, but you gotta really hustle to get them because it's not easy to get them. If you're interested in knowing how to do this business, schedule time. I'll show you how to do it. I'll see you in the next video.